Surprisingly, some fruits can actually speed up aging, harm your brain, and raise your blood sugar even more than a can of soda. A recent study in the Journal of Clinical Nutrition found that adults over 65 who ate a lot of certain sugary fruits had a terrifying 57% higher chance of developing metabolic syndrome. This is a serious condition linked to strokes, diabetes, and heart failure. The scariest part, these fruits are often marketed as healthy or good for digestion, but they might be silently damaging your body every single day. If you're over 65, your metabolism slows, your cells are more vulnerable, and your ability to process sugar drops sharply, which means picking the wrong fruit can have grave consequences, and fast. But there's good news too. Some fruits are nature's medicine for older adults. They can help lower blood pressure, strengthen your heart, and even make your brain function years younger. In this video, we reveal the 4 crucial fruits that seniors should eat every day, along with the 4 they must avoid completely. Make sure you don't miss the last one on the danger list. It's a delicious, refreshing favorite, but it could be quietly draining your energy and shortening your life. Before we get started, we want to hear from you. Leave a comment below with where you're watching from, and please hit that like button and subscribe to our channel for more content like this. Now, let's dive right in. An avocado. Yes, avocado is a fruit, and it deserves its spot here for powerful reasons. In a welcome change from old nutritional advice that demonized all fats, avocados are one of the most beneficial foods a senior can add to their diet. Their unique power comes from a high concentration of monounsaturated fats, especially oleic acid. This amazing compound has been shown to effectively reduce harmful LDL cholesterol while boosting beneficial HDL cholesterol. For seniors with heart concerns, this unique fat profile is an incredible advantage, as better cholesterol levels lead to a reduced risk of heart attacks and strokes. But that's just the beginning. Many seniors don't realize avocados are a fantastic source of potassium, containing about 975 milligrams per fruit more than a banana. This makes them a great tool for managing blood pressure, a key issue since nearly 2/3 of adults over 65 are affected by hypertension. Avocados are a powerhouse of potassium, which works to counteract sodium intake and relax blood vessel walls. This natural approach helps bring blood pressure readings into a healthier range without extra medication. Beyond their heart-healthy benefits, avocados are rich in lutein, an antioxidant that protects eye health and slows the progression of age-related macular degeneration, a leading cause of vision loss in older adults. One of the most overlooked benefits of avocados is their incredible ability to increase nutrient absorption. Many vitamins and antioxidants in vegetables, like vitamins D, E, and K, are fat-soluble, meaning your body needs fat to absorb them properly. Adding avocado to your salad or cooked greens can increase your absorption of these essential nutrients by up to 15 times. That's a huge benefit for anyone trying to get the most from their meals without taking a dozen supplements. The secret to getting all these benefits: just half an avocado a day is all it takes. Spread it on whole grain toast, mix it into a smoothie, or eat it with a squeeze of lemon. No matter how you enjoy it, this fruit is a game changer for senior health. Number 3. Fresh, crisp, delicious apples. Apples are loaded with fiber, especially a type called pectin, which nourishes the good bacteria in your gut. A healthier gut leads to better digestion, a stronger immune system, and superior nutrient absorption, 3 things that become even more important as we get older. What makes apples truly special is their impact on heart health. Pectin binds to cholesterol in your digestive system, helping to flush it from your body and gradually lowering your LDL cholesterol levels. Apples are also full of flavonoids like quercetin, known for their ability to reduce inflammation and promote a healthy cardiovascular system. Plus, we have to talk about their importance for blood sugar control. While apples are sweet, they have a low glycemic load. Their fiber content slows the entry of sugar into your bloodstream, preventing those frustrating spikes and crashes. This can be extremely helpful for seniors dealing with insulin resistance or type 2 diabetes. Apples are also incredibly filling due to their high fiber and water content, making them a great choice for managing appetite. Here's a surprising little-known fact. Chewing apples boosts saliva production, which helps fight off cavities and gum disease, issues that become more common with age. Whether they're red, green, or yellow, apples are one of the most convenient and versatile fruits. Just one a day can benefit almost every major system in your body. 2. Pomegranate. Pomegranate might not be a go-to daily snack, but for seniors, this vibrant red gem is like a miracle tonic for heart health. As we age, our arteries can become less flexible, leading to reduced blood flow, higher blood pressure, and more stress on the heart. Pomegranate stands out for its high content of punicic acid, a powerful antioxidant shown to lower oxidative stress in arteries by over 30%. According to research in the journal Atherosclerosis, studies suggest that punicic acid could have 3 times the antioxidant power of red wine or green tea. As oxidative stress builds up, it causes inflammation and narrows your artery walls, like rust in an old water pipe. But punicic acid helps improve blood flow, ensuring it moves more smoothly and effortlessly. Research also shows that pomegranate juice can reduce systolic blood pressure by 5 to 21% in people with hypertension, making it a powerful option for seniors trying to manage their blood pressure without extra medication. There's even more. Pomegranate also boosts memory and brain function. A UCLA study found that older adults who drank pomegranate juice daily saw noticeable improvements in verbal memory tests compared to those who didn't. This is key, as memory loss is one of the most feared parts of getting older. Pomegranate juice provides many of the same dental health benefits without the need to chew, while concentrated antioxidants in supplement form have shown promise. Eating the whole fruit offers extra fiber and key micronutrients. Here's the deal: you don't need to drink a whole glass every day. Just a half cup of the seeds or a splash of juice in your smoothie can offer major benefits. Pomegranate is also unique among sugary fruits for its low glycemic index, meaning it won't cause sharp spikes in blood sugar. This makes it an ideal choice for seniors managing pre-diabetes or type 2 diabetes. Just be sure to choose 100% pure pomegranate juice without added sugars. And if you're on blood thinners, talk to your doctor first, as pomegranate can have a slight interaction with some medications. This fruit doesn't just boost your health, it can extend your health span by keeping your heart young for longer. #1. The wonderful world of berries. Berries, especially blueberries, raspberries, and blackberries, are at the top of our list of recommended fruits for seniors, offering a truly remarkable range of anti-aging benefits that no other food can match. Berries are crucial for seniors because of their incredible effects on cognitive function and brain health. These little gems are full of anthocyanins, plant compounds that not only give blueberries their rich color, but also act as powerful antioxidants. Eating berries unleashes potent compounds that help reduce inflammation in the brain while improving communication between brain cells. Stunning research in the journal Annals of Neurology showed that seniors who ate just 2 servings of blueberries a week experienced a significant delay in cognitive aging by as much as 2.5 years. This means they effectively preserved the mental abilities of someone 2.5 years younger. The brain-protecting effects seem to come from berries' ability to cross the blood-brain barrier, neutralizing oxidative damage directly in brain tissue, and the benefits go beyond memory. Blueberries can also improve balance and coordination, playing a key role in preventing falls, a leading cause of injury in older adults. Regular berry consumption also has major cardiovascular benefits. Numerous studies show significant drops in blood pressure, improved artery flexibility, and lower inflammation markers in older adults who make berries a staple in their diet. These effects lead to a big drop in the risk of heart disease, a crucial factor, since it remains the top cause of death among older adults. In addition to these impressive benefits, berries are excellent for blood sugar management. The fiber and bioactive compounds work together to stabilize glucose levels after a meal, preventing the dangerous spikes that can worsen diabetes or pre-diabetic conditions. Berries contain about 8 grams of fiber per cup, making them a great choice for supporting digestive health and promoting regularity while being gentle on sensitive stomachs. Just 1 cup a day in your oatmeal, yogurt, or smoothie can boost your energy, sharpen your focus, and lift your mood. Be sure to choose fresh or frozen berries for the best results. Avoid dried varieties, which often have added sugars that defeat the purpose. Now that we've covered the top 4 fruits seniors should eat, it's time to look at the 4 you should steer clear of, starting with one that might be in your kitchen right now. #4. Grapes. On the surface, grapes seem like a perfect, healthy snack. These little gems are sweet and refreshing, and they're even praised for their high antioxidant content, especially in the red and black varieties. However, for seniors, grapes can be very deceptive. The main issue is their extremely high sugar content combined with very little fiber. Grapes are packed with a natural sugar called glucose fructose, and it's easy to eat them by the handful, which can cause you to overdo your sugar intake without even realizing it. A single cup of grapes contains a shocking 23 grams of sugar. That's about the same as a small candy bar. For older adults who struggle with blood sugar control, this can be a serious problem. Without enough fiber, the sugar is absorbed rapidly into the bloodstream, causing sharp spikes in blood glucose and insulin levels. These spikes are not just temporary, they are linked to weight gain, inflammation, and a higher risk of developing type 2 diabetes. Another concern is that grapes often have pesticide residue if they aren't organic, posing a potential risk to seniors with weakened immune systems or sensitive digestion. The skin of a grape, while thin, offers minimal nutritional benefit compared to the skins of other fruits like apples or pears. The bottom line: grapes may look harmless, but they can wreak havoc on your blood sugar, making them a significant risk for seniors trying to keep their energy, weight, and metabolic health in check. #3. Delicious dried fruits. Dried fruits, especially those that are commercially processed with sulfites, are a troublesome option for seniors, despite their reputation as a healthy and convenient snack. The biggest problem with dried fruits is their incredibly high concentration of sugar. As water is removed during the drying process, what's left behind is essentially concentrated fruit sugar. A small handful of dried apricots has roughly the same amount of sugar as several whole, fresh apricots. This makes it far too easy to overconsume fructose without the fiber and water that typically make you feel full. This level of sugar concentration is a big problem for seniors with diabetes or insulin resistance, as even a small amount can cause severe spikes in blood glucose. Over time, this can lead to type 2 diabetes or make managing existing diabetes much harder. But the effects go beyond that. These sugar spikes lead to increased inflammation in the body, which can make arthritis pain worse, accelerate cognitive decline, and weaken the immune system, something seniors can't afford to risk. Adding to the concern, many commercially produced dried fruits contain added sulfites, which are chemical preservatives used to preserve color and extend shelf life. Sulfites can trigger severe asthma reactions in sensitive individuals, especially among seniors. Age-related changes in lung function and a higher rate of asthma and COPD in older adults make this group particularly vulnerable. About 1 in 100 people have sulfite sensitivity, a number that rises significantly among older adults with breathing problems. The concentrated sugars and preservatives in dried fruits can be especially problematic for seniors dealing with inflammatory conditions like arthritis, which affects nearly 50% of adults over 65. Number 2. Green bananas. Ripe bananas with brown spots can be a healthy choice for many seniors, but unripe, or green, bananas come with notable health risks, making them one of the least favorable fruit options for older adults. The primary issue with unripe bananas is their high content of resistant starch. This type of starch is different from the easily digestible sugars in ripe bananas because it resists digestion in the small intestine. For seniors facing age-related digestive changes, like reduced enzyme production and slower gut motility, this resistant starch can cause significant gastrointestinal discomfort such as bloating, gas, and stomach cramps. Seniors with irritable bowel syndrome or inflammatory bowel conditions face an even greater challenge, as these conditions are more common with age. The difficulty in digesting unripe bananas is more than just an inconvenience. It can interfere with the absorption of nutrients from other foods eaten in the same meal. This is a serious issue for seniors who may already have nutrient deficiencies due to medication interactions, a poor appetite, or age-related changes in nutrient absorption efficiency. In addition, the astringent compounds in unripe bananas, which cause their distinct chalky texture, can irritate the lining of the digestive tract in sensitive people, possibly leading to inflammatory responses in the gut. From a nutritional standpoint, unripe bananas are lower in antioxidant content compared to ripe ones, as these beneficial compounds increase significantly during the ripening process. For seniors hoping to get anti-inflammatory benefits from fruit, the lower antioxidant levels in unripe bananas make them a poor choice. 1. Grapefruit. Surprisingly, grapefruit is at the top of our list of fruits seniors should avoid. While it's often praised as a healthy food and a weight loss tool, grapefruit can pose a serious and potentially life-threatening risk for seniors who take common prescription drugs. Furanocoumarins in grapefruit are the culprits, as they inhibit an enzyme in your intestine called CYP3A4. This enzyme is crucial for metabolizing around 85 different medications. When this enzyme is inhibited, drug levels in the bloodstream can reach dangerously high concentrations. It's like receiving a much larger dose than you intended, even though you took the right amount. The potential for side effects can increase dramatically, with some being severe or even fatal depending on the medication. This long list of affected medications includes many that are frequently prescribed to seniors. It includes popular statins for lowering cholesterol, like atorvastatin, lovastatin, and simvastatin, certain blood pressure medications, calcium channel blockers like nifedipine, anti-anxiety drugs, buspirone, antiarrhythmia drugs, amiodarone, and even some antihistamines and immunosuppressants. For example, eating grapefruit while on the statin Lipitor can raise the drug's concentration in your blood by more than 400%, sharply increasing the risk of serious side effects like muscle breakdown and kidney failure. What's even more concerning is that these interactions can happen without eating a lot of grapefruit. Just half of a fruit or a small glass of juice can trigger a dangerous interaction, with effects lasting for up to 72 hours after consumption. So, simply separating your medication and grapefruit intake won't solve the problem. Given the significant potential for interaction and the sheer number of vital medications affected, grapefruit is the single most important fruit to either avoid or approach with extreme caution. It is critical to speak with your doctor or pharmacist about the safety of consuming grapefruit or grapefruit juice if you are on any prescription medication. Never assume it's okay. The risk of magnifying your medication's effects or side effects is not a chance you can afford to take. A fruit that seems harmless could actually be a source of dangerous interactions. Conclusion. So, there you have it, a comprehensive guide to the fruits seniors should embrace, and the ones they should steer clear of. Nutritious choices like avocado, apples, pomegranates, and berries can genuinely help you slow down aging, sharpen your mind, and boost your strength. However, certain foods like grapefruit, dried fruits, unripe bananas, and even seemingly harmless grapes can secretly drain your energy, spike your blood sugar, and increase inflammation, putting your health at risk. The alarming part is how subtle it is. Many people don't realize a handful of grapes or a not quite banana could be creating a cascade of problems in their body until it's too late. Make wise choices, enjoy your food, and when possible, pair your fruit with protein or healthy fats. We are curious to know your thoughts. Are you unknowingly eating these harmful fruits? Which one was the biggest shock to you? Have you ever had an unexpected reaction after eating a particular fruit? Share your stories and thoughts with us in the comments section below. We'd love to hear from you. Thanks for watching.